missing one.
Today's topic is the short and long-term effects of ADHD medication on children.
First, we'll give you some facts on this very important topic.
11% of U.S. children are now diagnosed with attention deficit hyperactivity disorder, or ADHD.
Boys were more likely than girls to have ever been diagnosed with ADHD, 13.2% to 5.6%.
The average age of ADHD diagnosis was 7 years of age, but children reported by their parents as having more severe ADHD were diagnosed earlier.
There are several treatment options for ADHD, and not all of them are medications.
In the average American classroom, 2 out of 3 children are on some dosage of ADHD medication.
Behavior therapy, including parent training, school accommodations, and interventions are a few examples, but we will get to those later.
Some of the short-term side effects include sleep problems, decreased appetite, delayed growth, headaches and stomach aches, rebound, which is irritability when the medication wears off, tics, and moodiness.
Some more short-term side effects of ADHD medication include nervousness, appetite suppression, insomnia, and increased blood pressure and heart rate.
While ADHD medications are said to be non-addictive, parents should monitor their children because children with ADHD are at the higher risk for substance abuse as they age.
Doctors do not know much of the long-term side effects of many ADHD medications because very few long-term studies have been done.
Since not many long-term studies have been done, there is no proof that ADHD medication has negative effects on brain growth and development. However, many researchers are concerned and believe that many medications prescribed for ADHD do have negative effects on brain growth and development in children.
The American Heart Association has stated that anyone with a heart condition, even minor, should not take stimulants prescribed for ADHD.
There is also a higher risk for psychiatric problems. If there is a family history of any mental illness, the child taking ADHD medication should be monitored during use and even after stopping the drug.
Children who take ADHD medication were shown to weigh an average of 6 pounds less and be 1 inch shorter than children who were not.
Medication should be seen as the last treatment to try for children, not the first, as there are many other options available.
Ritalin is the most prescribed drug for children. As children build up a tolerance to the drug, they may need to go on higher and higher doses.
If the child needs to come off Ritalin, withdrawal symptoms are usually shown. The higher the dosage, the worse the symptoms, some as severe as major depression and suicide.
In a study, mice were given an injection of cocaine or Ritalin. The study found that in both cases, certain regions of the brain changed, but the mice who received the injection of Ritalin saw more changes than the other mice. Researchers are calling for more studies on the long-term effects of the drug and what it does to the brain.
Now we'll watch a short video on alternate treatment options for children with ADHD.
This may look like just another video game, but it might be the answer to curing ADHD for 13-year-old Devin Coons.
0.0.
6 million kids in the U.S. are like Devin, diagnosed at the age of 7 with ADHD, or attention deficit hyperactivity disorder, struggling to concentrate throughout the day.
Definitely really hard to, stay focused.
But now, researchers at Ohio State's Wexner Medical Center conducting a study by using video therapy to teach children how to control their symptoms just by using their mind.
Just try to relax. We attach sensors to the scalp that picks up the natural electricity in the brain, and we train them to speed up their brain waves.
Devin must concentrate to keep the spaceships flying where they should.
I'm feeling a little tired today.
An exhausting task for someone learning how to retrain their brain to focus. 3.5 million kids in the U.S., including Devin, are taking medication for ADHD. His mom hoping, with the help of this study, someday he won't have to.